Good evening all, welcome to my channel Brain Health Series. You might have heard this word sleep study or the polysomnography studies. What is it all about? What tests do they do during the sleep in this polysomnography studies? And who are the candidates who should undergo this polysomnography studies or the sleep studies? Are both these terms same or are they different? So what are the benefits of undergoing these studies? Let us try to answer all these questions. So sleep study is a general term which is used for any test which is done to evaluate the sleeps. Whereas the polysomnography is nothing but a specific type of the sleep studies where they collect certain physiological parameters to assess the sleep related breathing disorders or the sleep related disorders. So what are the indications for the sleep studies or the polysomnography studies? Who are the candidates who should undergo a polysomnography studies? So first thing is sleep related breathing disorders, that is obstructive sleep apnea is one thing which is the most indications. In fact, to detect any sleep related breathing disorders, the polysomnography study is a gold standard. So obstructive sleep apnea is one indication. Anybody with the neuromuscular disorders and the sleep complaints, those with the on treatment for the CPAPs or the BiPAP, that is positive airway pressures for the sleep related breathing disorders, to look for the response or the titrations of the CPAPs to the BiPAPs. So it's also done for those with as a pre-surgical evaluations for those who are undergoing upper airway surgeries, and it's also done post-surgery to look for the response. It is also done for the nocturnal epilepsy. Nocturnal epilepsy is nothing but those who get seizures only during sleep. It's also indicated for the narcolepsies. It's also indicated for the sleep-related periodic limb movement disorders. So, and RBDs, that is REM behavioral disorders. So these are the commonest indications for a sleep studies or the polysomnography studies. So what are the parameters what do they do, or what are the parameters they collect during the polysomnography studies? So what do they do, how do they do, and what do they do? Here, so these are certain parameters, physiological parameters we collect during the studies, polysomnography studies. Those are, we look for the brain waves, that is EEG, electroencephalography we do, bilateral frontal, central and occipital regions. Electrodes are placed and we collect the brain waves during the studies. And next we also do electroocculograms, that is REM, rapid eye movement disorders, rapid eye movement related disorders, and the eye movement parameters are collected by using EOG, that is electroocculogram. Next is the EMGs, electromyographies, muscle tone, muscle movement is collected from the chin, submentalis muscles, and also from the leg, the tibialis anterior muscles. So then is the pulse oximeter is connected to look for the saturations. ECG, electroencephalography, is done to look for the heart rate and rhythm. Then we also do nasal pressures are monitored. Oronasal thermal flow pressures are also monitored. Changes are also monitored during the sleeps. And we look for the respiratory movements, that is the chest movements and the abdomen movements during the studies. And the audio and the visual aids, audio and video are collected during the sleeps of the patient to record the voice, that is snoring, and video basically to look for the body positioning during the sleeps or any limb movements during the sleeps. So these are the parameters which are collected during the monitoring polysomnography studies. So we know what is done. So what are the preparations do they make during these polysomnography studies? What the patient should know about this, where it is done, how it has to be done, how the condition has to be for conducting a polysomnography studies. First thing is, the patient is instructed and counseled regarding the polysomnography studies. So it's an overnight sleep studies where the patient has to come to the sleep lab. How the sleep lab should be, the patient is made to sleep in a quiet, cool and a dark room. So that the patient should come in his regular night suits what do they do regularly before going to bed, and patient is made to empty the bladder before undergoing these procedures, and the patient is instructed or taken some certain information from the patients about the medications, because we know that certain sedatives like opioids or the diazepam group of medications can alter the studies, so we need to have an information regarding that. Next, the patient is instructed everything about the studies, and the sleep technologist will be there throughout the entire night to collect the parameters, to look for any changes, to monitor, to attend to the patients. There has to be some preparations should also be there to tackle any emergencies. Like in case if the patient has any arrest during the procedures, if the patient has any seizures, gets any seizures during the sleep or during the studies, there has to be some facility to tackle to all these emergencies during the studies. So all this preparation should be there, all this facility should be there in a sleep lab before conducting the studies. So now we know what is sleep study, what is polysomnography studies, who are the candidates who should undergo these polysomnography studies, what are the parameters we collect during the studies, and what are the preparations the patient has to make during the studies. So once we have collected all the informations, where we know the brainwave changes during the sleeps, electrooculogram, the eye movements during the sleeps, chin movements or the limb movements during the sleeps, the respiratory movements, pulse saturations, any changes in the airway pressures. So all those things, ECGs or pulse saturations through the pulse oximeters, we collect all these parameters and we try to analyze this entire overnight studies, and we try to come into conclusions regarding the sleep related breathing disorders, whether it is because of is there any apneas, hypoapneas, or if there is any other entity which is interrupting the patient's sleep. Are there any seizures activity during the sleeps? Patient do they have any REM behavioral disorders? Do they have any limb movement disorders? Are they breathing pattern fine during the sleep? What is the body position during the sleeps? With the audio visual aids, we collect all these informations and try to analyze and conclude and come into conclusions about any sleep related breathing defects or the sleep related disorders. And once we collect the informations, we try to give a treatment to the specific treatment after making a diagnosis. Say for example, obstructive sleep apneas. The obstructive sleep apneas, the most important parameters or the most important contributing factors is, one is the age, body mass index, as well as the gender. It's more common in males. So these are the people who are more prone for this, and once their obstructive sleep apneas is detected, we give a treatment and positive airway pressures. After the treatment and before the treatment, we try to compare and look for the response or the improvement in the quality and quantity of the sleeps. Similarly, even if those patients who have been treated for say for example congestive heart failures and the sleep breathing defects, after the treatment or after the titrations, we look for if the sleep has become better after the treatment.